Good afternoon, everyone. Thank you for being with us this afternoon. Nice sunny day. We've got several things to chat with you about today, and of course, we will take your questions. Beginning with COVID today, I don't have to tell you that our COVID numbers are across the region are very, very serious. They continue to go up, more positive cases, more people going into the hospital, more people actually still in the hospital. I'll give you a few of those numbers. The city of St. Louis continues to look better in terms of new cases than surrounding counties. That's not a particularly good stat. We're happy for that, but they're still not good. So over the weekend on Friday, we reported 166 cases. On Saturday, 269. On Sunday, 115. That brings our 7-day average in the city of St. Louis of new cases to 142. So that's up considerably. You can see from these numbers that a lot of cases, they tend to come in unevenly, which is how you end up with one day with a huge number of cases. But overall, they are still trending up, going up. Number of people currently hospitalized with COVID positive, and this is in the region, it's 2 days old, 718 COVID positive, 119 maybe suspected positive. So that is an increase to 837. You probably saw yesterday, I believe it was, BJC has suspended some of the elective surgeries just so that they can have beds available. And of course, no surgery is really elective. Nobody wants to have a surgery, but some can be postponed or put off, and that's what they are doing now. Number of people in the ICU yesterday, 155, 84 on ventilators. Those numbers are both up, and 96 patients admitted. This was reported yesterday, so 2 days ago would have been Friday. And 88 people discharged on the 15th, 133, 116, 109. So people, of course, are coming back out of the hospitals. But we know that folks that actually have to be admitted to the hospital are extremely ill with COVID. So these numbers are very worrisome. We also know that hospitals, that communities around the region, particularly in the outlying areas, do not have the strong healthcare system that we have here for acutely ill patients. And so a number of those patients are also coming to the hospitals here in our St. Louis region. You would expect that. Last week, I guess 5 days ago or so, there were almost 100 patients in our hospitals here in the St. Louis region that are from the outlying areas. So that, of course, is difficult. We have very few mask mandates in outlying areas, and their numbers are even spreading even more quickly than our numbers are. Couple of things here. We'll post the charts from the pandemic task force. You know what they look like. They're going up like this. So what can we do? Last week we issued order number 15, and order number 15 said, please, private gatherings. So get-togethers, parties, having people over to watch sports, Thanksgiving, please keep those gatherings as small as possible or not at all. And that's because we know from our contact tracing that the spread of this virus is happening among families. It's happening in small groups, friends, neighbors, who are understandably tired of these restrictions, but we are going to have to hang in there a little bit longer. We we really are asking people, in addition to, of course, always wearing your mask, always social distancing, always washing your hands, but please don't get together with other people as much as possible. That includes Thanksgiving. These multi-generational gatherings where you got the kids, the teenagers, aunts, uncles, cousins, mom, dad, grandma, great-grandma, those are just very risky and dangerous events. Because if someone is positive in that group, asymptomatic or not, you risk really getting a whole lot of people in your family to be COVID positive. You don't want that. We don't want that either. There are other places that are following, quite a few other places that are following similar guidelines as we have. And Kansas City just today, it was actually Jackson County, just today put out that they're following very similar guidelines, keeping these private gatherings, either don't have them, that's the best, or keep them very small within your own household or maybe one other household. Of course, when you are out, be sure to wear your mask. Bars and restaurants in the city do remain open for indoor dining, but at only 50% capacity and with social distancing and mask wearing. Outdoor dining is preferred, of course, but you know, we have a lot of people who are working in our bars and our restaurants. So dine outside if you can, do carry out, do curbside pickup. Understand that these are really very vulnerable times for these businesses, and they're doing all they can to stay open and to keep people employed. What else for today? Well, on maybe a little bit of good news from this morning. You remember that last week Pfizer announced that it was in clinical trials, and the Pfizer vaccine was turning up 90% positive. Well, this morning Moderna, who SLU, St. Louis University, is doing testing on the Moderna trials. They reported 94.5% positive, and you know, if the FDA, or when the FDA approves either one or both of these, then we're looking forward to distribution of the vaccine quickly across the nation. Of course, we will, you know, be in this with the nation. We of course want healthcare workers to have access to it, first responders, vulnerable populations, and all of us. Ultimately, both of these are 2-dose vaccines, and so it's just encouraging news. It's not an announcement that it's going to be here for sure, because the approval process is not complete, but it is encouraging as we are all worn out by all these regulations and by not seeing our friends and family and that sort of thing. It's encouraging to be able to look forward to maybe the first of the year, or at least the first quarter. We hope next year that some of these vaccines will be able to begin being rolled out. Our own health department is working closely with the CDC and on the rollout process, because that will also be important. And there are private groups, Walgreens, CVS, other folks who are also our federally qualified health centers, who will also be involved in that rollout. And 94.5% or 90%, that's good. I hope that holds. You know, the flu vaccine, which I took, I hope you did, you know, isn't 90% effective. We all know that's because there are different strains of the flu, and you never know exactly what the mix will be in any given year. But that's some positive news on these vaccines. And I know we're all hanging on every announcement for these vaccines. I am, and I imagine you are as well. I know doctors and hospitals certainly are. This morning, 10 o'clock, changing the subjects here, Our application for $5,000 grants to small businesses went live at 10 o'clock this morning. That's $1.25 million, which will be available to them, and we are giving preference to people in the hospitality industry. So that's bars and restaurants and event spaces and wedding planners and folks whose businesses have been so decreased by the restrictions and by the virus. So other businesses can get it as well, but we are giving preference to those. So if you are a small business, you know someone who's a small business who has not gotten, who did not get one of the first rounds, please encourage them to apply for this second round. There's a little bit of a change to it, which is that the first time through we said one business can only get one $5,000 grant. This time, if you have two locations, both in the city, so one south, one north, and you got one for the location that was north, now you could get one for the location that is south as well, qualify. Have to have a business license. On Friday, I think I gave a shout out, I'm going to do it again, to license collector Mavis Thompson, because she has made the business license information available to St. Louis Development Corporation so that they can quickly see whether or not somebody has a business license. That saves that business a little bit of trouble of either finding their license or coming down and getting a copy and that sort of thing. So that's good. And the last thing, the Missouri legislature was supposed to go into session tomorrow. Was it tomorrow?
It was this week for sure.
This week, I think tomorrow, but they've postponed that until after Thanksgiving because of the COVID cases in their midst. So, that's what I have for today. Do we have questions?
Yeah. Couple of questions. So starting with a question about casinos. This is from Z, Mayor. Whose authority are they under, city or state, and what sort of restrictions are they currently under? What kind of restrictions are they currently under?
Casinos are controlled by the state gaming association. They are currently, there's only one casino in the city, and it is currently operating at about 25% capacity and is very diligent about mask wearing. So they are still open. They are under the authority of the state.
Amy has a question about enforcement, Mayor. So she's seen bars who maybe are staying open past 11, maybe pushing their capacity restrictions. Who in the city enforces these things, and who can someone in the community report this to if they see someone violating COVID-19 orders?
Amy, any bar or restaurant that you see staying open past 11 or not wearing masks or requiring mask wearing, you should report to 622-4800. That's the Citizen Service Bureau. You're going to have to tell us the name. Please give us the address, the date that the incident happened or is happening, so that we can follow up on that. As you may know, we've given warnings to a number of folks. Even before a warning, often there's a telephone call to the manager or the owner of the bar or the restaurant saying, hey, follow these guidelines. We do have the authority to shut people down. We don't like to do it. We like to bring them into compliance.
We did get two questions today about what are the current guidance and recommendations for people who are considered office workers, not necessarily bar or restaurants. Is the city or the health department encouraging folks to work from home if they possibly can?
Yes, and that we are encouraging. If you work in an office, and of course you got to work with your supervisor about this, but if you work in an office and you can work from home, that's always a preferable situation. I know many people are doing that. They may come into the office, a day a week, or they may just Zoom with their coworkers. I know a number of people who are physically in their office, if they have an office, and they Zoom with somebody who's just down the hall from them rather than actually coming together and getting in the same room with them. always a good idea. You want to limit your exposure. And you know, I'll just mention that there are many, many people who, when they are quarantined or when they are contact traced, they give the information that says, yeah, I was exposed outside of my workplace. Some people are exposed inside the workplace, but not as many as you might think. Many, many of the exposures come from outside the workplace. Someone in their household tests positive, or their friend group, someone's positive, and then they have to quarantine. Hopefully they don't turn up positive. But it's not just about working from home. It's about working from home, staying at home. You know, if you're going to work from home, well, you have to adjust the rest of your behavior also, so that you're not exposing yourself.
Chanel wrote in with a question, Mayor, about order number 15, and what was the city and health department's thinking about limiting private gatherings, but some businesses can continue to operate and some large venues can stay open? So
the reason that we limited private gatherings is really to send a message to you, to each one of you, that it is really, we know the spread is happening in homes, in neighborhoods, with friends and families, neighbors getting together. We know that from our contact tracing. So trying to send that message to folks that please adjust your behavior on that. Now, there are bars and restaurants can still be open, but they have gone to great lengths in most cases to have plexiglass dividers, to have additional air circulation. And when you go there, you won't be with a big group of people. You should only be with your people you're attending there with your household. So we know that you'll do whatever you want to in your own home. Honestly, we do know that. But we also know that the vast majority of people want to do what they can to stop the spread of COVID. And so we're just asking you to stop and think about your private gatherings. Keep them extremely small.
Question from Blair, Mayor, about college students, especially college students who will be returning home to the city of St. Louis for the holidays after Thanksgiving. What is the city and the health department's recommendations for them? Do they need to be quarantining? Are we concerned about them bringing more COVID to the community?
Well, I think that's a good question, but it goes both ways. Your college student that lives in your house might be coming home for Thanksgiving, although I know many, many who are not. They really should quarantine before they get on that plane or before they drive home. Obviously, if you're just home for a short period of time, very difficult to quarantine while you are at home. And that's why I'm really recommending not traveling, whether you're a college student or whether you're a family member, not traveling for Thanksgiving or for the holidays. Now, you've likely noticed that SLU, St. Louis University, for example, I believe is making testing available to students before they leave campus, a few days before, so they'll get the test results back. They are also at SLU, at least when you go home for Thanksgiving, you won't be coming back until after the first of the year for the beginning of the second semester. So colleges are very, and universities are being very diligent about this, but it is certainly a matter of everybody's, what you and your family choose to do.
Couple more COVID questions before other topics. What does the vaccine rollout look like in the city of St. Louis? Is the health department actively working toward making it available when it is able to be available?
Yes, I mean that I answered that question I think a minute ago, but basically our health department is working with the CDC, working with the federally qualified health centers and private, Walgreens, CVS, in order to really be able to push this out into the community. Our health department won't be personally giving all those vaccines. Other people will, but they are working on that distribution process with the CDC. So is the state of Missouri. Everybody is working on that. The other thing about these two vaccines that I talked about a minute ago is that they have to be refrigerated at very cold temperatures. One of them, the Pfizer one, much colder, I think 72 degrees below zero, and the Moderna one is 20 degrees below. But in either case, they have to be kept in very controlled environments, and then you have to get two of them. But yes, our health department is you know, they're working on pushing more tests out. We're doing more and more testing. They're working on contact tracing for people that are coming back positive, and as you could tell if you were here at the beginning of the session here, we've had a lot more people turn up positive. So, and they're working on the vaccine. So they're quite busy at this point in time.
A couple of non-COVID related topics. We had a couple of people watching and asking today about whether the city has yet reconsidered the restrictions on in-person visits at the 2 detention facilities, which was put into place to prevent the spread of COVID-19. Have any of those precautions been lifted at this point?
Those precautions have not been lifted, and there's no, if you look at the numbers and how quickly the numbers are going up, I mean, there's no need, there's no reason to ease restrictions at this point in time. If anything, you know, they need to be enforced more than ever.
So Bill has a question about parks and leaves. Has the city considered reopening all the roads again at Carondelet Park, and what is the leaf pickup schedule?
So 2 different questions. Reopening all the roads at Carondelet Park. We are leaving those roads closed for the time being, and primarily so that people can get out and walk, get exercise, walk in the roads. Prefer walkers over cars. I know that's a bit of an inconvenience for some people, but there are a whole lot of people who love having that additional space available to safely walk or ride their bike in. So that is not changing anytime soon. And the second thing is, what about leaf pickup? Leaf pickup happens on your street sweeping day. So, you know, second Tuesday, third Wednesday, whatever, I think that's mine. Whatever your days are, that's your leaf pickup day. It's important for you on that day, if you want your leaves picked up, to rake them out into the street a little bit away from the curb, so that it's easier for the sweeper to pick them up. And you know, it's always an issue at this time of year. You can also, by the way, put your leaves in the green yard waste dumpsters. You know, you can put out a plastic tarp, break yours all on the tarp, drag the tarp to the alley, and put them in the yard waste dumpster. You know, smash them down. That's another way to get your leaves up. So, not everybody can do that, though. We get that.
This might be our last question. Just came in from Jeff, wanting to know, moving forward, is there a case threshold or a hospitalization threshold level that you're keeping an eye on that would trigger additional restrictions in the city of St. Louis?
What we're doing, Jeff, is we're keeping an eye on the numbers in the region. And we're also looking at the city numbers. But there isn't once we hit this number, we'll do X. You know, that has been done successfully, and I like the way it's been done in a couple of other states. Maryland, for example, Colorado. It's been a state, Illinois. It's been a statewide look at things. Here we are in our city of St. Louis, our 62 square miles, and surrounded by St. Louis County, surrounded by St. Charles, Jefferson, Franklin counties. And, you know, if we could be more collaborative, that would be a good way of setting these sort of limits, but we have not been able to do that yet.
That's it for today.
That's it for today. Thank you all. Appreciate you being with us today. And please, go out when you need to, but you know, try to keep your groups really small, and just take additional precautions. I know you're tired, but please take additional precautions. Thank you.